My name is Dr. Scott Bursing, plastic surgeon here at Plastic and Hand Surgical Associates. So body contouring describes a variety of procedures, sometimes after massive weight loss or pregnancy, that the skin is stretched out to a degree that it does not recover, and that seems to diminish as we age, or maybe we have some excess skin or lipodystrophy or excess fat. Those are all kind of addressed under the banner of body contouring procedures. People who have really hit their strides in terms of weight loss and now they're seeking to improve their contour even further because they're in a good place, both emotionally, mentally, and with their appropriate dietary habits and exercise habits, and they feel like now the excess skin is not retracting in the way they prefer, and they're really looking to try to enhance their recovery by seeking body contouring procedures that would allow them to exercise more comfortably, fit into clothing better, and just overall improve their feelings about themselves and get the kind of the image that they're looking for, that the body that they feel like they deserve and have worked so hard for. While it is a relatively routine thing to do here at Plastic in Hand, it doesn't mean that the patient's lost in the disease process. And I think that's what makes us stand above the rest in terms of that approach. You'll see your doctor. It's not you'll see your surgeon on the day of the surgery and that's it. You're going to have a long longitudinal relationship with that surgeon for a long time. What that means is we sit down, we have a good hour to chat, talk about maybe your past medical history a bit to make sure that you're a safe candidate, that it's the right time for the surgery, because I think that's important as well, is understanding when that surgery should take place. Hopefully within a couple months of kind of the initial consultation, we're head off to the operating room for a day surgery, and then a few hours later you're on your way home if all is going well and the patient's comfortable. We typically have a couple drains in place, a little abdominal binder to help with compression. At a week or so, 2 weeks, the drains are coming out, the patient's moving on to the next phase of care, which is generally sort of this gradual reintroduction to more normal activities. And then hopefully somewhere around 4 to 6 weeks later, the incisions are mostly healed at this point. It's just a matter of scar maturation, which takes place over the next year. Fortunately, most patients are very satisfied early on. Your clothes are going to fit a lot better right away, and you're going to be shopping at different stores pretty soon. That's not to say there's not a recovery, there's not a process there, but the results can be pretty dramatic right away for patients. It's not infrequent to hear that this has been life-changing.